Hello, I'm Dr. Daniel Frank, and I practice general internal medicine here at MedNorthwest. I did my undergraduate education at UCLA, where I studied neuroscience, and then I went to medical school at the University of North Carolina at Chapel Hill. Well, who am I kidding? I never went to college. But what I did is learn Photoshop really well, and after I printed all these bad boys up, life changed a lot for me. Now, I had to convince the folks down in Ole that these were legit, and once I did that with the medical board, I was raring to go. Of course, had to watch a lot of YouTube videos, particularly when it comes to in-office surgeries. Don't want to mess those up. My career started out in emergency medicine. Even though I trained as an internist, I was a young buck and I wanted to see some blood and guts and some heart attacks and do procedures, intubate patients, put in chest tubes. You know how it is when you're young. But ultimately, emergency medicine is not that cerebral a specialty. We don't pay ER docs to think. We pay them to order CAT scans. And boy, oh boy, are they good at ordering CAT scans. And I'm grateful, because if one of my patients goes to the emergency room up at Swedish, I know they're going to get a comprehensive, really careful workup and some CAT scans. We've been around since 2002. Some things have not changed at all, and some things have changed. The things that haven't changed here are the commitment to two big ideals. And the first is this. It's the New England Journal of Medicine around here. This is a solid Western medicine, scientific, academically oriented, evidence-based practice. It's in the core of our DNA. And the second thing is a tremendous commitment to the customer service experience. When I practiced emergency medicine, a patient would show up in the lobby with hand wrapped in a towel at home. I just cut myself with a chainsaw, blood is dripping down. And the clerk would say, well, give me your insurance card, sit over there, it'll be a wait. I thought to myself, is this any way to greet somebody who's just had an emergency? When I first started, I didn't really sell the practice too aggressively. I'd tell a patient, look, if you're happy with your doctor and the office where you're getting care isn't too bad, keep that relationship going. There's no need to come see me. But I have to say that year over year, as I've been in practice, the situation in what I call the real world, out there at the big hospitals and large clinics, has just gotten worse and worse every year. I can't tell you the hundreds of times that I've sat down with a patient and heard a litany of just mind-blowing experiences. I canceled my annual exam and they told me I would have to reschedule and it would be 9 months out. I was 10 minutes late for my appointment. They told me I couldn't be seen and I'll have to come in 3 weeks, but I had a terrible sore throat. I needed my heart medicine refilled and they said, well, we won't refill it unless you come in for an office visit, but we can't schedule for an office visit for 3 months. I mean, I hear this stuff all day long. And so I've kind of begun to change my messaging a little bit. And what I tell patients now is, look, if you can afford to put yourself in a concierge medicine practice, you should do so. It doesn't have to be here, but the state of affairs right now, at least in the Pacific Northwest, certainly here in Seattle, is so difficult for patients that I think that people really need to find a way to be in a concierge medicine practice if they have that need. Now, although some things have been the same at MedNorthwest, other things have changed. When I was first in practice, it was just me. And I never really liked that. I thought it would be best for patients, best for my staff, best for the practice to have a group of clinicians here. And over time, I've worked hard to recruit a stellar group of colleagues that are excellent physicians, excellent in primary care, and really committed to the same philosophy that I have about MedNorthwest. I have to say this, if my career had been spent in one of the mills where I have to see 20 or 25 people a day and I'm constantly rushing from room to room, I don't believe I would have had the same kind of impact on patients' lives that I have had in this job. Well, if you're on the website looking around thinking, maybe I should check these guys out, my advice to you is look at some of the videos, read the articles we have here, read the bios of the various clinicians who practice here, and if it's something you might be interested in, sure, come on in for a meet and greet visit, and we can sit down and see if MedNorthwest would be a good mutual fit for your needs.